Welcome back to Road to Nursing License. Today's Nclex practice is focused on labor and delivery, one of the most important and frequently tested topics on the Nclex. These questions cover the stages of labor, fetal monitoring, cervical changes, pain management, obstetric emergencies, medications, nursing interventions, postpartum priorities immediately after birth, and patient education. After each question, I'll explain the correct answer, why the other options are incorrect, and share a practical strategy to help you answer similar Nclex questions with confidence. If you're ready to strengthen your clinical judgment and move one step closer to your nursing license, let's get started. Question 1. A laboring client is 4 centimeters dilated, 80% effaced, and the fetal station is 0. Which stage of labor is the client in? A. First stage. B. Second stage. C. Third stage. D. Fourth stage. Correct answer, A. First stage. Rationale. The first stage of labor begins with the onset of true labor contractions and ends when the cervix is fully dilated to 10 centimeters. A client who is 4 centimeters dilated is still in the first stage of labor. Strategy. Remember the stages of labor: first stage, 0 to 10 centimeters dilation; second stage, 10 centimeters to birth; third stage, birth of the baby to delivery of the placenta; fourth stage, first 1 to 4 hours after placental delivery. Question 2. A nurse is assessing fetal heart rate during labor. Which finding is considered normal? A. 90 beats/min. B. 110 beats/min. C. 165 beats/min. D. 180 beats/min. Correct answer, B. 110 beats/min. Rationale. The normal fetal heart rate ranges from 110 to 160 beats/min. A rate below 110 indicates fetal bradycardia, while a rate above 160 indicates fetal tachycardia. Strategy. Memorize the normal fetal heart rate range, 110 to 160 beats/min. Question 3. A client suddenly reports a gush of fluid from the vagina. What is the nurse's priority action? A. Assess the fetal heart rate. B. Encourage the client to walk. C. Check the maternal temperature. D. Notify dietary services. Correct answer, A. Assess the fetal heart rate. Rationale. After rupture of membranes, the priority is assessing the fetal heart rate to detect umbilical cord prolapse or fetal distress. Strategy. After the water breaks, always think FHR first. Question 4. Which finding indicates that a client is entering the second stage of labor? A. Cervix is 5 centimeters dilated. B. Cervix is completely dilated. C. Placenta begins separating. D. Lochia becomes heavy. Correct answer, B. Cervix is completely dilated. Rationale. The second stage of labor begins when the cervix reaches 10 centimeters dilation and ends with the birth of the baby. Strategy. Second stage equals 10 centimeters plus pushing plus delivery of the baby. Question 5. Which medication should the nurse have readily available after delivery to help prevent postpartum hemorrhage? A. Magnesium sulfate. B. Oxytocin. C. Terbutaline. D. Betamethasone. Correct answer, B. Oxytocin. Rationale. Oxytocin stimulates uterine contractions after birth, helping the uterus contract firmly and reducing the risk of postpartum hemorrhage. Strategy. Think oxytocin equals contracts the uterus equals controls bleeding. Question 6. A laboring client suddenly reports severe abdominal pain, and the fetal heart rate drops to 90 beats/min. Which action should the nurse take first? A. Reposition the client to the left side. B. Encourage the client to push. C. Prepare the client for discharge. D. Administer oral fluids. Correct answer, A. Reposition the client to the left side. Rationale. A sudden decrease in the fetal heart rate may indicate fetal distress. Repositioning the client to the left lateral position improves uteroplacental blood flow and oxygen delivery to the fetus while additional interventions are initiated. Strategy: for signs of fetal distress, think intrauterine resuscitation, left side, oxygen. For fluids, stop oxytocin if infusing, and notify the provider. Question 7. Which finding indicates true labor rather than false labor? A. Contractions decrease with walking. B. Contractions occur at irregular intervals. C. Cervical dilation and effacement occur. D. Pain is relieved by hydration. Correct answer: C. Cervical dilation and effacement occur. Rationale: true labor causes progressive cervical dilation and effacement. False labor contractions do not result in cervical change. Strategy: the best indicator of true labor is cervical change. Question 8. A nurse is caring for a client receiving oxytocin to induce labor. Which finding requires immediate intervention? A. Contractions every 2 to 3 minutes lasting 60 seconds. B. Fetal heart rate of 170 beats/min. C. Cervical dilation of 6 centimeters. D. Maternal blood pressure of 124/76 mmHg. Correct answer: B. Fetal heart rate of 170 beats/min. Rationale: a fetal heart rate above 160 beats/min indicates fetal tachycardia and may be a sign of fetal distress requiring immediate assessment and intervention. Strategy: when oxytocin is infusing, always monitor the fetal heart rate closely. Question 9. A laboring client asks for an epidural. Which assessment should the nurse perform before the procedure? A. Assess blood pressure. B. Check bowel sounds. C. Measure fundal height. D. Assess pedal pulses only. Correct answer: A. Assess blood pressure. Rationale: epidural anesthesia can cause hypotension. A baseline blood pressure is essential before administration. Strategy: remember, epidural equals risk of hypotension. Question 10. The nurse notes variable decelerations on the fetal monitor. What is the most likely cause? A. Uteroplacental insufficiency. B. Umbilical cord compression. C. Fetal sleep cycle. D. Maternal fever. Correct answer: B. Umbilical cord compression. Rationale: variable decelerations are abrupt decreases in fetal heart rate caused by compression of the umbilical cord. Strategy: remember, early equals head compression. Variable equals cord compression. Late equals placental insufficiency. Question 11. A client who is 10 centimeters dilated tells the nurse she feels a strong urge to push. What should the nurse do? A. Encourage the client to begin pushing. B. Tell the client to wait another hour. C. Administer a tocolytic medication. D. Place the client in Trendelenburg position. Correct answer: A. Encourage the client to begin pushing. Rationale: a client who is fully dilated and feels the urge to push has entered the second stage of labor. Strategy: never encourage pushing until the cervix is fully dilated. Question 12. Which assessment finding requires immediate intervention after rupture of membranes? A. Clear amniotic fluid. B. Moderate contractions. C. Prolapsed umbilical cord. D. Cervix dilated to 5 centimeters. Correct answer: C. Prolapsed umbilical cord. Rationale: a prolapsed umbilical cord is an obstetric emergency because it can cut off oxygen to the fetus. Strategy: cord prolapse equals emergency. Call for help immediately while relieving pressure on the cord. Question 13. Which maternal position improves uteroplacental blood flow during labor? A. Supine. B. Left lateral. C. Prone. D. Trendelenburg. Correct answer: B. Left lateral. Rationale: the left lateral position reduces pressure on the inferior vena cava, improving blood flow to the placenta. Strategy: when fetal distress occurs, turn the client to the left side unless contraindicated. Question 14. Which finding suggests uterine tachysystole in a client receiving oxytocin? A. Contractions every 5 minutes. B. More than 5 contractions in 10 minutes. C. Cervical dilation of 8 centimeters. D. Maternal pulse of 88 beats/min. Correct answer, B. More than 5 contractions in 10 minutes. Rationale. Uterine tachysystole is excessive uterine activity that can decrease fetal oxygenation and requires prompt intervention. Strategy. If contractions become too frequent, stop the oxytocin and assess the fetus. Question 15. A nurse is assessing a client immediately after delivery. Which finding is expected? A. A firm uterus at the level of the umbilicus. B. A boggy uterus with heavy bleeding. C. Continuous severe abdominal pain. D. Absent lochia. Correct answer, A. A firm uterus at the level of the umbilicus. Rationale. Immediately after birth, the fundus should be firm and approximately at the level of the umbilicus. Strategy. Firm fundus equals good. Boggy fundus equals think postpartum hemorrhage. Question 16. Which medication is commonly administered to help mature fetal lungs before a preterm birth? A. Oxytocin. B. Betamethasone. C. Misoprostol. D. Methylergonavine. Correct answer, B. Betamethasone. Rationale. Betamethasone is a corticosteroid given to accelerate fetal lung maturity when preterm birth is anticipated. Strategy. Betamethasone equals baby's lungs. Question 17. A laboring client has late decelerations on the fetal monitor. What is the nurse's priority action? A. Reposition the client to the left side. B. Encourage the client to push harder. C. Increase the oxytocin infusion. D. Ambulate the client. Correct answer, A. Reposition the client to the left side. Rationale. Late decelerations indicate uteroplacental insufficiency. Repositioning the client improves placental blood flow while additional interventions are initiated. Strategy. Late decelerations equals placental problem. Improve oxygen delivery first. Question 18. Which client is most likely to require continuous fetal monitoring? A. A low-risk client in early labor. B. A client receiving oxytocin infusion. C. A client walking in early labor. D. A client admitted for false labor. Correct answer, B. A client receiving oxytocin infusion. Rationale. Oxytocin increases uterine contractions and can lead to fetal distress if contractions become excessive, requiring continuous fetal monitoring. Strategy. Oxytocin always requires close monitoring of contractions and fetal heart rate. Question 19. The nurse is caring for a client whose contractions are becoming stronger, longer, and closer together. What does this indicate? A. False labor. B. Progression of true labor. C. Placental separation. D. Uterine rupture. Correct answer, B. Progression of true labor. Rationale. As labor progresses, contractions become stronger, longer in duration, and more frequent, contributing to cervical dilation and fetal descent. Strategy. True labor contractions become stronger, closer together, and lead to cervical change. Question 20. A nurse is caring for a laboring client who suddenly develops bright red vaginal bleeding and severe abdominal pain. What is the nurse's priority action? A. Assess the fetal heart rate and notify the healthcare provider immediately. B. Encourage the client to continue pushing. C. Assist the client to the bathroom. D. Prepare the client for discharge. Correct answer, A. Assess the fetal heart rate and notify the healthcare provider immediately. Rationale. Bright red vaginal bleeding with severe abdominal pain may indicate a serious obstetric emergency, such as placental abruption. Immediate assessment of the fetal heart rate and prompt notification of the healthcare provider are essential to protect both the mother and the fetus. Strategy. On the Nclex, sudden vaginal bleeding with severe pain during labor is an emergency. Prioritize maternal and fetal assessment using the ABCs and fetal monitoring before implementing additional interventions. Question 21. A nurse is assessing a laboring client. Which finding indicates the client is in the transition phase of the first stage of labor? A. Cervical dilation of 2 centimeters. B. Cervical dilation of 5 centimeters. C. Cervical dilation of 9 centimeters. D. Delivery of the placenta. Correct answer, C. Cervical dilation of 9 centimeters. Rationale: the transition phase is the final phase of the first stage of labor and occurs when the cervix dilates from approximately 8 to 10 centimeters. Contractions are strong, frequent, and painful. Strategy: remember the phases of the first stage: latent, 0 to 3 centimeters, active, 4 to 7 centimeters, transition, 8 to 10 centimeters. Question 22. A laboring client receiving an epidural becomes hypotensive. What is the nurse's priority action? A. Place the client in the left lateral position. B. Encourage the client to push. C. Increase the oxytocin infusion. D. Place the client in a supine position. Correct answer, A. Place the client in the left lateral position. Rationale: hypotension is a common complication of epidural anesthesia. Repositioning the client to the left side improves venous return and uteroplacental perfusion. Strategy: for epidural-induced hypotension, remember, left lateral position, for fluids, oxygen if needed, and notify the provider. Question 23. Which fetal heart rate pattern is considered reassuring? A. Moderate variability. B. Late decelerations. C. Persistent bradycardia. D. Absent variability. Correct answer, A. Moderate variability. Rationale: moderate variability indicates a well-oxygenated fetus with a healthy autonomic nervous system. Strategy: moderate variability is one of the best indicators of fetal well-being. Question 24. The nurse is caring for a client with a prolapsed umbilical cord. Which action should the nurse perform first? A. Place the client in knee chest or Trendelenburg position. B. Encourage the client to push. C. Remove the cord. D. Apply fundal pressure. Correct answer, A. Place the client in knee chest or Trendelenburg position. Rationale: positioning helps relieve pressure on the prolapsed cord and improves blood flow to the fetus until an emergency birth can occur. Strategy: cord prolapse equals relieve pressure, call for help, prepare for emergency delivery. Question 25. A client in labor asks why contractions are becoming stronger. Which response by the nurse is most appropriate? A. Strong contractions help your cervix dilate and move your baby downward. B. Strong contractions mean labor is stopping. C. This indicates your placenta is separating. D. It means your baby is in distress. Correct answer, A. Strong contractions help your cervix dilate and move your baby downward. Rationale: as labor progresses, contractions become stronger to promote cervical dilation and fetal descent. Strategy: patient education questions often test your ability to provide accurate reassurance. Question 26. Which finding is expected during the third stage of labor? A. Complete cervical dilation. B. Delivery of the placenta. C. Crowning of the fetal head. D. Increasing cervical effacement. Correct answer, B. Delivery of the placenta. Rationale: the third stage of labor begins after the birth of the baby and ends with the delivery of the placenta. Strategy: remember, baby equals end of second stage. Placenta equals end of third stage. Question 27. A client receiving oxytocin develops contractions lasting 100 seconds with only 30 seconds of rest between contractions. What should the nurse do first? A. Stop the oxytocin infusion. B. Increase the infusion rate. C. Encourage the client to ambulate. D. Continue to observe. Correct answer, A. Stop the oxytocin infusion. Rationale: excessively long and frequent contractions can reduce fetal oxygenation. The oxytocin infusion should be stopped immediately. Strategy: too many contractions equals stop the oxytocin first. Question 28. Which assessment finding requires immediate notification of the healthcare provider during labor? A. Maternal temperature of 98.8 degrees Fahrenheit 37.1 degrees Celsius. B. Fetal heart rate of 100 beats/min. C. Cervical dilation of 7 centimeters. D. Contractions every 3 minutes. Correct answer, B. Fetal heart rate of 100 beats/min. Rationale: a fetal heart rate below 110 beats/min indicates fetal bradycardia and may signal fetal compromise. Strategy: normal fetal heart rate is 110 to 160 beats/min. Question 29. The nurse is caring for a client immediately after delivery. Which assessment finding suggests uterine atony? A. Firm fundus. B. Boggy uterus. C. Scant lochia. D. Blood pressure 118/72 mmHg. Correct answer, B. Boggy uterus. Rationale: a boggy uterus is a classic sign of uterine atony, the leading cause of postpartum hemorrhage. Strategy: boggy uterus plus excessive bleeding equals massage the fundus and notify the provider if bleeding continues. Question 30. A laboring client reports constant back pain during contractions. Which fetal position is most likely? A. Occiput posterior. B. Occiput anterior. C. Breech. D. Transverse lie. Correct answer, A. Occiput posterior. Rationale: the occiput posterior position often causes intense lower back pain, commonly referred to as back labor. Strategy: back labor equals think occiput posterior. Question 31. Which client is at the greatest risk for postpartum hemorrhage? A. A client with uterine overdistension from multiple gestation. B. A client with a singleton pregnancy. C. A client with normal labor progression. D. A client with spontaneous vaginal delivery and no complications. Correct answer, A. A client with uterine overdistension from multiple gestation. Rationale: an overdistended uterus is less able to contract effectively after delivery, increasing the risk of postpartum hemorrhage. Strategy: overdistended uterus equals higher risk for uterine atony. Question 32. A nurse is assessing contractions using an external monitor. Which characteristic should the nurse document? A. Frequency. B. Blood glucose. C. Cervical dilation. D. Proteinuria. Correct answer, A. Frequency. Rationale: external fetal monitoring can determine contraction frequency and duration, although intensity is best assessed by palpation or an intrauterine pressure catheter. Strategy: know what each monitoring method measures. Question 33. A laboring client says, "I can't do this anymore." The nurse recognizes this statement most commonly occurs during which phase? A. Latent phase. B. Active phase. C. Transition phase. D. Fourth stage. Correct answer, C. Transition phase. Rationale: clients often feel overwhelmed, irritable, or unable to continue during the transition phase because contractions are at their strongest. Strategy: transition equals most intense phase of labor. Question 34. Which medication is commonly administered to stop preterm labor? A. Terbutaline. B. Oxytocin. C. Methylergonavine. D. Carboprost. Correct answer, A. Terbutaline. Rationale: terbutaline is a tocolytic medication that relaxes the uterus and may temporarily delay preterm labor. Strategy: terbutaline equals tocolytic equals stops contractions. Question 35. Which finding indicates successful pain relief following epidural anesthesia? A. The client reports decreased pain. B. Blood pressure increases significantly. C. Fetal bradycardia develops. D. Contractions stop completely. Correct answer, A. The client reports decreased pain. Rationale: the primary goal of epidural anesthesia is to reduce labor pain while allowing labor to continue. Strategy: Evaluate pain interventions based on the client's report and overall maternal fetal status. Question 36. A client is 10 centimeters dilated, 100% effaced, and the fetal head is crowning. What is the nurse's priority? A. Prepare for the birth of the baby. B. Administer a tocolytic. C. Encourage the client to walk. D. Delay pushing for 1 hour. Correct answer, A. Prepare for the birth of the baby. Rationale. Crowning indicates the baby's head is visible at the vaginal opening and birth is imminent. Strategy. Crowning means delivery is about to occur. Question 37. Which finding is an early sign of placental separation? A. Lengthening of the umbilical cord. B. Loss of fetal station. C. Decreased uterine tone. D. Cervical closure. Correct answer, A. Lengthening of the umbilical cord. Rationale. Signs of placental separation include a lengthening umbilical cord, a firm globular uterus, and a sudden gush of blood. Strategy. Know the classic signs of placental separation. Question 38. A nurse is caring for a client with preeclampsia during labor. Which medication should the nurse anticipate administering to prevent seizures? A. Magnesium sulfate. B. Oxytocin. C. Terbutaline. D. Betamethasone. Correct answer, A. Magnesium sulfate. Rationale. Magnesium sulfate is the medication of choice for preventing and treating seizures in clients with preeclampsia. Strategy. Preeclampsia plus seizure prevention equals magnesium sulfate. Question 39. The nurse notes recurrent late decelerations despite repositioning and oxygen administration. What should the nurse anticipate next? A. Preparation for an emergency cesarean birth. B. Encouraging more frequent pushing. C. Increasing oxytocin. D. Ambulating the client. Correct answer, A. Preparation for an emergency cesarean birth. Rationale. Persistent late decelerations that do not resolve with intrauterine resuscitation suggest ongoing fetal compromise and may require an emergency cesarean birth. Strategy. If interventions fail to improve fetal status, prepare for rapid delivery. Question 40. Immediately after birth, which nursing assessment is the highest priority? A. Assess uterine firmness and vaginal bleeding. B. Measure the newborn's length. C. Assist visitors into the room. D. Complete discharge teaching. Correct answer, A. Assess uterine firmness and vaginal bleeding. Rationale. The immediate postpartum priority is identifying postpartum hemorrhage. Assessing the fundus and lochia helps detect excessive bleeding early. Strategy. After delivery, think fundus, bleeding, vital signs. Postpartum hemorrhage is one of the most life-threatening maternal complications. Question 41. A laboring client suddenly reports an intense urge to bear down. What should the nurse do first? A. Assess cervical dilation. B. Encourage the client to push immediately. C. Administer pain medication. D. Assist the client to ambulate. Correct answer, A. Assess cervical dilation. Rationale. Before encouraging the client to push, the nurse must confirm that the cervix is fully dilated. Pushing before complete dilation can cause cervical edema or injury. Strategy. Never encourage pushing until you know the cervix is 10 centimeters dilated. Question 42. A client in labor has fetal heart rate decelerations that begin after the peak of each contraction and return to baseline after the contraction ends. These are: A. Early decelerations. B. Variable decelerations. C. Late decelerations. D. Accelerations. Correct answer, C. Late decelerations. Rationale. Late decelerations are caused by uteroplacental insufficiency and are a non-reassuring fetal heart rate pattern that requires prompt intervention. Strategy. Remember, early equals head compression. Variable equals cord compression. Late equals placental insufficiency. Question 43. A nurse is caring for a client receiving magnesium sulfate for preeclampsia. Which assessment finding requires immediate intervention? A. Respiratory rate of 10 breaths/min. B. Blood pressure of 150/92 mmHg. C. Mild flushing. D. Warm skin. Correct answer, A. Respiratory rate of 10 breaths/min. Rationale: magnesium sulfate toxicity can cause respiratory depression. A respiratory rate below 12 breaths/min requires immediate intervention, including stopping the infusion and notifying the healthcare provider. Strategy: when monitoring magnesium sulfate, remember to assess respirations, deep tendon reflexes, and urine output. Question 44. A client delivers the placenta. Which nursing action should be performed next? A. Assess uterine tone and massage the fundus if boggy. B. Encourage the client to walk. C. Begin discharge teaching. D. Remove the forecatheter. Correct answer, A. Assess uterine tone and massage the fundus if boggy. Rationale: after placental delivery, the nurse should immediately assess uterine firmness because a boggy uterus increases the risk of postpartum hemorrhage. Strategy: after every birth, think fundus, bleeding, bladder, vital signs. Question 45. A nurse is teaching a client about breathing techniques during labor. What is the primary purpose of patterned breathing? A. Eliminate contractions. B. Increase cervical dilation. C. Promote relaxation and improve coping with labor pain. D. Shorten the third stage of labor. Correct answer, C. Promote relaxation and improve coping with labor pain. Rationale: patterned breathing helps reduce anxiety, promotes relaxation, and improves the client's ability to cope with contractions. Strategy: breathing techniques don't stop labor, they help the client manage it. Question 46. Which client is at the highest risk for umbilical cord prolapse? A. A client with a breech presentation. B. A client at 39 weeks with a cephalic presentation. C. A client in active labor with an engaged fetal head. D. A client with a singleton pregnancy in vertex presentation. Correct answer, A. A client with a breech presentation. Rationale: a breech presentation increases the risk of umbilical cord prolapse because the presenting part may not adequately block the cervical opening after the membrane's rupture. Strategy: think of cord prolapse with breech, transverse lie, or a high, unengaged presenting part. Question 47. Which finding indicates that postpartum oxytocin is effective? A. A firm, contracted uterus. B. Blood pressure of 150/96 mmHg. C. Decreased urine output. D. Increased heart rate. Correct answer, A. A firm, contracted uterus. Rationale: oxytocin stimulates uterine contractions, helping the uterus remain firm and reducing postpartum bleeding. Strategy: oxytocin equals firm uterus equals less hemorrhage. Question 48. A nurse is caring for a client in labor whose fetal monitor shows recurrent variable decelerations. Which intervention is most appropriate? A. Reposition the client. B. Encourage pushing. C. Increase the oxytocin infusion. D. Place the client in the supine position. Correct answer, A. Reposition the client. Rationale: variable decelerations are caused by umbilical cord compression. Repositioning the client can relieve pressure on the cord and improve fetal oxygenation. Strategy: variable decelerations equals cord compression equals change the mother's position first. Question 49. A nurse is caring for a client immediately after a vaginal birth. Which assessment finding requires immediate intervention? A. A boggy uterus with heavy vaginal bleeding. B. Scant lochia rubra. C. A firm fundus at the umbilicus. D. Mild perineal discomfort. Correct answer, A. A boggy uterus with heavy vaginal bleeding. Rationale: a boggy uterus accompanied by heavy bleeding is a classic sign of uterine atony, the leading cause of postpartum hemorrhage. Immediate fundal massage and additional interventions are necessary. Strategy: on the Nclex, boggy fundus plus excessive bleeding equals postpartum hemorrhage until proven otherwise. Question 50. A nurse is caring for a client during labor. Which assessment finding requires the highest priority intervention? A. Maternal report of increasing contraction pain. B. Cervical dilation of 8 centimeters. C. Fetal heart rate of 90 beats/min lasting 5 minutes. D. Bloody show. Correct answer, C. Fetal heart rate of 90 beats/min lasting 5 minutes. Rationale: a prolonged fetal heart rate of 90 beats/min indicates significant fetal bradycardia and possible fetal compromise. Immediate interventions are required to improve fetal oxygenation and prepare for possible emergency delivery if the pattern does not resolve. Strategy: when prioritizing labor and delivery questions, always focus on maternal safety first, then fetal oxygenation. Persistent fetal bradycardia is an obstetric emergency requiring immediate action.